And we need more ambulances. The general issues around, I think have resonated elsewhere. What I'll say is two things, is that the legal requirements needing to be changed were changed with Initiative 1 and 2. There's some advantages coming last. We've put in the best. We're the only regulator in the world that registered 3 levels of professional, EMT, paramedics, advanced paramedics. The UK registered paramedics. Other places don't. So we've got a tight regulatory change. We got the laws changed. We have to practice as a practitioner in Ireland at the sharp end, any of those 3 ends. You need to be working for an organisation approved by us, whether it's private, voluntary, statutory. You need to be registered on our register. Second thing, and you need to be acting under our guidelines under the medicines regulation. So that's a triple lock that no one else is good. So sharp end, we're getting there. Have we enough? Well, we want more, but we're getting there. I'm very happy with sharp end. On those issues of those nuances, professional almost makes the decision. I remember being a fresh doctor and just graduated, and I was told from the hospital, will you go out, there's a ship at sea and we need someone to go out, and there's a person with a heart attack. We found out a team there of sailors had been resuscitating. It was somebody who was cold and dead. Now, we didn't say what you've done stupid, right? You got professional decision, and we said, look, we think he's passed. We did 20 minutes, we finished, right? So I think if that's done professionally and there's discretion and there's good training, that will happen. The bigger risk to me is if you're doing that because they're scared of litigation and not doing it, really the employer should be scared of litigation, that there's somebody else who's 40-year-old and healthy and could survive, and you've got your people deployed on a cold body. That's where the litigation would be. That aside, I wouldn't be genuine in this group if I didn't come here and say they're the 2 biggest issues for me at the sharp end. We're even setting up a retrieval service, and the HSE have asked me to lead on that. So at the moment we've had a neonatal service that everyone knows brings sick patients in from the car. Everywhere else has had these for 10 to 15 years, wall to wall. But we're now going 24/7 with neonates, and probably before the end of the year. And we've also got money to establish these in Cork and Galway for adults 7 days a week daytime, and in Dublin. And we're setting it up in paediatrics. So before long, not only are we getting the pre-hospital sharp end somewhere, we're getting the inter-hospital. If I want to be frank, right, there's too much discussion about response times. The ones that are currently in the law are flawed, totally flawed and meaningless. And the biggest risk to patients at the moment, and we've only got snapshot data, is between hospitals. The second thing is your system is logjammed. If you go to any hospital in the country, Dublin or around the country, you've got the wrong patients in the wrong places and they can't move. So you've got people out here who need to be in there because they can't be looked at after there. They miss the window. When they're being transported, they are at greater risk of bad outcome and dying than those who are out in the community ringing up for a 999. That's where the risk is. At the moment, that is in the mix for consideration of the service plan, right? It was in the mix last year. The bit to support it didn't get up. This year, it comes out next week or the next week. If it doesn't come out now we're not talking the sharp end. We want EMTs who are only 4 to 6 weeks training, right? So it's a low level of staff cost. It's a low level of ambulance cost. If we don't get them this year, I'll be thinking next year it'll be the same thing. Everyone's log jammed, your system is stuck. I'm very nervous about how it'll come out in the process this year, but gentlemen, I'll be around every year from here, and this issue of providing enough ambulances, right, will be there until it's fixed. We've just got a legacy where there was a thought that if you're in a hospital you're safe, if you're in the community and you ring 999 you're not. It's actually the very opposite. If you're in a hospital anywhere here, or you're between them, right, you're at, in my view, at greatest risk. And your system, listen, I agree with every bit of the reconfiguration of acute services, every bit of the grouping of places and linking to, every bit of it is sound. But if you don't put those ambulances in to do it, you cannot unlock it, and these people won't end up there. You visit any hospital, you go to Letterkenny, you go to Monaghan, you go to Albeen, and you go down to the Beara Peninsula, right? Everyone will tell you, actually, We've got who needs to be there. If he doesn't get there, he doesn't get his PPCI, he'll get open surgery or get medication. This person, we're out of our depth, but they haven't got a bed, but actually the person who's there, that hospital wants back, it is logjam. Every year that will be there until it's fixed. And I would be ingenuous if I said, but in my priorities, really what we're working on is those two issues here. That doesn't need law change, it just needs consensus. We'll get there. You can help on that. But on this other one, until that's resourced, that's it.